Hi guys, this is Dr. Afrah. I am a cosmetic physician and a general practitioner. Today I am joining Dr. Aliya, who is also a cosmetic physician, because we thought it'd be interesting to talk about some of the things that we love, some of the treatments we recommend highly. A lot of my patients always ask me what I do for my skin and what treatments I personally prefer for myself. And that can be different depending on different skin types. So I will talk a little bit about what I do, and then Aliya can also talk a little bit about what she does, but keeping in mind we're both of Asian background, which means that we are both people who have to be very, very careful with certain treatments. And we will probably start with the very basics of beauty, anti-aging and skincare, and then escalate the treatment to suit the individual. So I'm just waiting for Aliya to join me, and then I will invite her on. While we're waiting, I'd also like to tell you that Aliya is actually also a hair transplant surgeon, which means that she performs hair transplants as well. So we will ask her a little bit more about hair and hair transplants today as well. So I'm still waiting for her to join me. I'm hoping it'll be soon. Still waiting. Hi guys, thank you for joining us. If you've got any questions, feel free to ask us now, and I can ask Aliya as well. I'll just invite her on, so just bear with me. And of course, feel free to ask questions while we're having our chat as well. So Aliya should be with us shortly.
Hey,
Hi.
Afrah, how are you?
Oh, it's lovely to see you.
Lovely to see you too. You look beautiful as always. Love your hair.
Thank you. How's your day?
Always been a fan. Hey?
Oh, thank you. How's your day been today?
Oh my God, it's been really busy because I had an online teaching course this morning. So I teach for dermomedical, as you know. So because we can't do any physical training at the moment, we're just doing online theories. And so yes, I had a full day of 4 hours of online teaching this morning.
Oh, wow, that's incredible. So you must be
Yeah.
a little dead after that. But casual chat anyway. And I didn't make it too structured. We didn't talk about any questions. We just thought we'd just have a chat and people can join us and just be part of it. So I wanted to start with just the basics. And I was going to talk about how, because we both have that Asian background and a different sort of skin tone, it basically means that we have to be very careful in certain circumstances, not so careful in others. It means from a very basic cellular point of view that people with darker skin types make more collagen, which means Aliya and I will be young forever.
Thank God.
So our aging process is a little bit different to Caucasian skin types, because Caucasian skin types don't lay down as much collagen as we do. But the downsides of having dark skin tone is when we're in the sun, we don't absorb as much vitamin D because our skin is actually blocking the UV rays and the sunlight, which in a way is good because we don't get as much photo damage. But on the downside, we can be a little bit low on vitamin D. So sometimes we do have to take supplementation for this. The other downside of having darker skin type, there are a lot of lasers that we can't have. So at the Enrich Clinic, where I work with Dr. Michael Rich, we have every laser that you can think of, everything under the sun. And a lot of my patients say to me, which one would you have if you could have any of them? And I'd say, I would have the portrait, I would have the fractional CO2, I would have the erbium. These lasers just wipe lines off your face. But, and this is a big but, I can't have them. The reason being the darker skin types are more prone to post-inflammatory hyperpigmentation, as you and I know, but it's very important for patients to know what they're signing up for. Things like Fraxel, which take all of your freckles off in one go, whereas it sounds really interesting and it sounds really exciting and something you'd really want to do. If you've got darker skin types, my advice would be to not let anyone talk you into having these treatments, but actually go and see someone who's seen the good as well as the bad and can tell you to maybe steer away from some of those treatments and think about something else. So that's just a little bit of an overview of what we'll talk about. But starting with just basic, simple skincare, I think sun protection is the most important thing. Certainly for myself in my 20s, I don't think I really cared about my skin. And I used to go out in the sun and I thought, I'm dark skin, I'll be fine. I'm not going to get a melanoma. There are worse things than a melanoma. Actually, I shouldn't say that. But that's right. that's a bit of a joke amongst cosmetic physicians that the worst thing is aging. Please don't take me seriously. A melanoma is the worst thing that can happen to you. But skin cancers aside, photo damage is something that is generally quite difficult to reverse. So once your skin is damaged, and every time you have a tan, just a tan, your skin is damaged. That's what a tan means. A tan means your skin just got damaged. A sunburn means your skin got severely damaged. And as we know, the more sunburns you've had in your lifetime, the more increased risk of skin cancers you have. So in my 20s, I didn't really care, but luckily because I am darker skinned, I am a little bit more protected. But in my 30s, I have become very mindful of being in the sun. I will avoid the sun as much as I can. I don't go to the beach in the hours that the sun is at its strongest. I'll go in the afternoon, in the evening even, and I wear a lot of sunscreen. So even today, when I haven't left my house and I'm just doing this live interview, but because I'm in the sun, because I'm in my living room with sunlight on me, I have still got my sunscreen on. So if you take your skincare really seriously, then sun protection is at the top. And now I will let Aliya tell us what her experience has been with sun protection, etc. Because Aliya, I don't know if you agree with me, but I feel like in my 30s, my skin is actually better than it used to be in my 20s. And I think that reverse aging is what we're actually going for.
I agree. So sun protection is something that I never cared about. I guess in my early 20s, mid 20s, I never really cared about the sun damage because I thought, you know, darker skin, I'm fine. I'll just get a little bit tanned. You know, it won't matter. But obviously we know that darker skins can also have skin cancers, and it's picked up quite late just because you have darker skin. So it's so important for us to wear it for that protection against cancers. But it's very funny when you tell patients that, when you tell them that the sun actually ages you a lot, that's when they start to get serious about sunscreen. It's quite funny that, you know, aging is something that we're so worried about, obviously in our industry. And just putting on sunscreen is the easiest thing that you can do to stop or to reduce your aging. So that's something that I always tell my patients. Like it really surprises me that patients who have cosmetic injectables still don't use sunscreen. And I tell them that's the easiest, cheapest thing that you can do if you're worried about aging. And the funny thing is that people think that foundation, that SPF in their foundation is enough. I always tell them, no matter what foundation you use, you can never get enough sun protection through makeup. First of all, it gives very patchy, because I thought it was fine to use makeup with SPF, and that's considered sunscreen. This was in my early 20s. But obviously we learn now that, you know, the SPF in makeup gives you patchy coverage, so it doesn't give you even coverage for sun protection. Also, the amount of makeup that you need to use to actually get that SPF, you'll be lathered in foundation to be able to get that SPF 15 or SPF 20 that they say. So I always tell them use SPF 50. Even 30, I think, is not enough to cover UVA protection. SPF 30 is great. I know that people say there's not much difference between SPF 30 and 50 in terms of UVB protection. But if you're worried about aging, you want to stop that UVA rays from coming into your skin, you need to use at least SPF 50. So that's something that I think people don't recognize, that UVB protection and UVA protection is quite different, and you have to be using broad spectrum SPF 50 to get enough coverage to protect you against UVAs. And I agree, since in my early or late 20s, when I started looking after my skin properly, I would say my skin is so much better compared to when I was younger. It's a lot more even, it's less oily, it's more hydrated, and that's just from taking care of your skin. So it's something that I'm sure you talk a lot about it, because obviously you work with a dermatologist, so skin is obviously number one in your practice. But I think, you know, I always touch about skin when I talk to my patients, even though they come in for, you know, a bit of anti-wrinkle or a little bit of filler. I always tell them you're not going to be happy because your skin's not going to look great. So you want your skin to look great, and that's the easiest thing, is just simple skincare. You don't have to have 10,000 things in your cupboard, even though I do. I have like I don't know how many skincare products I have, but you don't need to have all that much. You just need to have the right product for you and the right ingredients, and sunscreen every single day. So even though we've been locked down for the last 8 weeks, I wear my sunscreen every day. It doesn't matter if I'm going out for a walk or if I'm just staying home. Like today, I've just been literally indoors facing a computer and the phone. I'm still wearing SPF 50 at the moment. So, and the interesting thing that I just found out is that, you know, the amount of sunscreen that you use, the effectiveness of your sunscreen actually is related to the amount of sunscreen that you use. So if you think that you're using one pump and you cover it, you know, everywhere, it's still not enough. It's still not SPF 50. You need to use adequate amount of sunscreen to actually make it as effective and last as long as it says, which is, you know, 2 to 4 hours really with sunscreen. What are your thoughts between chemical versus mineral sunscreen?
Look, I think whichever works with your skin type. I don't have a problem with the chemical sunscreens. They just work differently. You've got the physical blocks and you've got the chemical blocks. And at the end of the day, the mineral sunscreens are really just a different formulation. The ingredients are pretty similar between the two. No sunscreen is just one ingredient anyway, because they don't provide enough coverage. So there are multiple ingredients in any case. And I think the terms organic, natural, and all of that is just marketing. At the end, get your attention. If they manage, great. It's good marketing, isn't it? But I think at the end of the day, what's more important is to look at sunscreen that gives great coverage. And this is something I think that your doctor can tell you a little bit better about.
I agree. So I think a lot of people have misconceptions about organic versus chemical sunscreen. People, I don't know, I've heard a lot from patients and even on social media that chemical sunscreen is bad for you. I think people need to realize the term chemical doesn't mean that it's bad. Sunscreen's been well researched, especially in Australia, because we have the highest number of skin cancers in the world. We have the most intense UV rays in Australia. And so our sunscreens, the TGA guidelines with our sunscreens are very, very strict. So for you to be able to sell sunscreen, you have to go through a lot of studies and to show that it's not harmful. And the chemical ingredients in a chemical sunscreen has been well researched over the years to not cause any harm to your skin. But you're right, anything is better than nothing. So even though if you want to use mineral sunscreen, totally fine with me as long as you're using adequate amounts. And also making sure that you're just using sunscreen, because so many people are still not using sunscreen, and that just, it's mind-boggling to me that people still don't use sunscreen every day.
And a couple of I'll say is I think Skin by Kane, I think it's said there are filters that are cytotoxic, and I agree that there are a lot of things in our skincare, in our makeup, in our sunscreen, in our lives, in our food, in our environment, in our clothes that are cytotoxic and probably poisonous, and in very small doses not as poisonous, in large doses absolutely poisonous. And I can tell you that even the parabens and things that make up skincare can be precancerous, but we have a certain list, and gradually the list keeps changing. There are things that are then shown to be toxic and they are taken out, but preservatives are still required, unfortunately. You can't make active skincare that's actually changing the way it protects you or changing your cellular structure without actually stabilizing it with something that is like, you know, the silicon-based things or the parabens. These are things that are stabilizing your product. So unfortunately, unless you go out in your garden and make up your own skincare every day, which is great if you do, because some people do, right? I have an aloe vera plant. I mean, I could do that. I could just rub it on my face. It's shown to have really great anti-inflammatory properties, and I could do that, but I'm short of time, and I want really, really active substances in my skincare, which cannot be stabilized without some of these toxic substances. Now, keep in mind that when we call things toxic, we're talking about large quantities, and the cumulative effect over a very long period of time of large doses may be toxic, but in the very, very minuscule doses that are just being used to stabilize the product, not as toxic. And I think it's really hard to get away from toxic substances, even in our food. I mean, your food would have so much toxicity in it. And I think it's just hard. So basically, you make the best of your situation and you make the best of what's available to you. And from that point of view, I think go for things that, yes, if the more pro-natural ones appeal to you, that's fine. At the end of the day, zinc is a great substance that you can just put on your face. Might make your face look white, but it's a great protector against the sun, and it's anti-inflammatory, it helps with wound healing. But unfortunately, you can't leave your house looking like that. If you're
No.
a field and your nose looks white, that's okay. But women don't want to leave, or even men don't want to leave their house with a white face, right? So you need sunscreen that's either completely colorless, or you need some sunscreen that's got a little bit of a brown pigment in it, so it looks like skin. And that's unfortunately where some of those unnatural ingredients or chemical ingredients come into play as well. But it's about what's worse, which is the worst thing.
So what would you say is what are you using for your sunscreen at the moment? What's your favorite sunscreens?
I'm allowed to say brand names, Alia?
Yeah. Sunscreens? Are we
Okay.
not allowed to?
So personally, I really like the La Roche line. We do stock, but I say to patients, I'm not interested in making money off of it. Okay, I don't have a sort of deal with the company where if I talk about it, I make money. I don't really care. You can go and get it from Chemist Warehouse. But the reason I like it is because in my entire life, I've only managed to use about 2 sunscreens that didn't cause problems on my skin. So very sensitive to sunscreen, and I agree, a lot of sunscreens can have substances in them that can sensitize your skin even more. So I used to have problems with pretty much anything I put on my face. So the only other one that I could use was the Clinique, I think it was this something city sunscreen or something. That was really gentle and I really liked it. And the second one that I use for my skin is the La Roche, and I use it for my 5-year-old daughter as well, and saw no problems with it. The ingredients are quite safe. They come in a lot of different formulations as well. So if you've got really oily skin, you can use, there's a mattifying one as well, or an oil control one that can actually make your skin more matte. And then the one I use is just ultra light, which means that even though it does have some oils in it, because all skincare creams and anything you get will have a little bit of oil in it. You unfortunately can't get away from oil either, but it's got very little oil in it, which means that even people with acne can use it if they want something really gentle. So that's my preferred brand at the moment. What about you?
I do like the La Roche. I am using at the moment the ultraceutical ones. I think they're really nice because they've got a bit of a moisturizer in them as well. So I have to put more on because I don't want it to be diluted. But I do find that the ultraceutical ones agree with my face, and I use a mattifying one because we have oilier type of skin. And they have a sheer tint one, which I have been using under my mask, to be honest. So I'm trying not to use I love makeup, as you know, but I'm trying not to use makeup when I'm using the mask when I go out for my walk. So all I do is I just put the sheer tint. It's got a little bit of a tint in it. Just gives me a little bit of coverage, makes me feel a little bit better. But it's kind of like 2-in-1. So I kind of like that. And the other thing that I always tell my patients is that your sunscreen doesn't have to be expensive. You can get something from Chemist Warehouse that's really good, like, the La Roche or Neutrogena or, any of those brands. As long as they agree with you, as long as you like them, as long as you wear them, you can get anything as a sunscreen. And the other thing is, if you buy an expensive sunscreen, you might feel, that you don't want to use too much of this product because it costs a lot. So buy a cheap sunscreen, use a lot of it, and just, give yourself the adequate sun protection.
On the flip side though, Alia, if you buy something expensive, you will use it. You won't waste it.
Yes, that's true. You want to use it. That's right.
You actually reminded me. The other one that I really liked was I was given a sample of the SkinCeutical sunscreen recently, and I really of it. It's
Okay.
and it just soaks into your skin and it dries to not a matte, more of a glow. And I've used it a little bit, but because I already have a favorite, it's difficult to switch. Now I think there was a question about using 30 years, It's absolutely fine. Whatever works with your skin, as long as you're looking after your skin, it's absolutely fine. But Soberline is not sunscreen. So I'm not sure if you asked that question in relation to what we're talking about. But I mean, Soberline for your face is fine. But obviously, no moisturizers take away the need for sunscreen. So sunscreen is still probably one of the main things you need to do as an anti-aging product or as protection as well for your skin, just to stop photo damage. So that's probably the cheapest way to stay young, I would say. Then I think the next step up would be the active products, right? So for
Yes.
me, we actually make up our own. So luckily, Dr. Rich actually makes his own retinoic acid. So that's what I've been using for years and years. So when people say, "What's your secret?" I'm like, "This is my secret. You could just use this." So there are script-based products, which means you can't get them over the counter because in Australia, anything over a certain concentration, you actually need a doctor's script for it, for retinoic acid. You can get the retinols and the retinals over the counter, but those are more precursors to retinoic acid. And the only active form of vitamin A in skin is retinoic acid. So your retinols and retinals actually have to convert to retinoic acid to work. So the only reason you would ever recommend the precursors instead of the active products for patients is if they're really, really sensitive and get a lot of irritation with the active ingredient, then they can use the retinols and the retinals. It might not give them as much of a reaction. But having said that, I've tried all of them and they all do the same thing to me. So I still get a little bit of that dryness, a little bit of that flaking, a little bit of that redness at the start, and then it all goes away when your skin gets used to it. I think someone asked about this other product, Mesoaesthetic Milan 130 Pigment Control 50 Plus. I'm not familiar with this product, to be honest with you. I'd need to actually look at the ingredient list in it, keeping in mind that there are a lot of different things that control pigment. So retinoic acid is only one of them. Then you've got the hydroquinone as well, which is the main bleaching cream that we use. But there's so many other products that treat pigment, and they're all really, really nice. So if you wanted to go with something more natural, then there's alternatives, definitely. But nothing works as well as retinoic acid does, and nothing, unfortunately, for pigment works as well as hydroquinone does. And I know there's always been a question of, are these toxic substances? Because in a lot of Asian countries, they use as a matter of course. They're not actually used to address a problem. They're actually used as prevention. So everyone wants to be lighter skinned. Everyone wants to have a very smooth, perfect, flawless complexion. That's the ideal beauty in Asia. So everyone tends to use a lot of hydroquinone, and I think some problems were seen with it. But what we know is with very prolonged use of hydroquinone, you might see a darkening of skin. So you can see the opposite reaction of what you're hoping for. It's called ochronosis. We don't really see it so much in the lighter skin types. It was actually, I think, seen in more the African skin types. But I still warn my patients and say, if you are using hydroquinone, now and then take a break for a few months and then go back and rebounds. So coming back to active ingredients and talking about pigment, I think pigment is probably the most common reason for people to seek out active ingredients. What's your experience been with that, Aliya? With your pigment?
Yeah, so before I answer that question, so Miley, Moo, and Mummy too, that's a cute name. So yes, we were talking about retinoic acid, which is vitamin A in its most active form, and that is tretinoin. So it's just a different name. So retinoic acid is kind of the chemical name. It is tretinoin, and it is available in Australia. You have to get a script for that, but you can buy other less active forms of vitamin A, like what Afrah was saying, with retinol and retinals over the counter with your skincare, and that is sold everywhere. You see retinol everywhere, but I agree. So retinoic acid, or vitamin A, is the most researched active ingredient in skincare. It's been researched for so many years. And actually, that's the only one to show that it benefits you in terms of collagen production, which is very interesting because we have so many skincare products for collagen production, but actually it's never been researched or proven. It's very hypothetical. So I always recommend vitamin A to my patients is because it's the most proven skincare ingredient to work. And it's got so many benefits. So apart from collagen production, it helps with pigmentation, as you said. It helps with evening out your skin tone, so you get a more even skin tone, and also helps with fine lines and wrinkles by helping with the collagen production. So I agree. I think vitamin A is the holy grail of skincare. I think everybody who is worried about aging needs to have some sort of a vitamin A in their skincare. I have used retinoic acid, which is tretinoin, and retinol. I find that I have to switch between the two if I find that my skin's getting a bit sensitive. So at the moment, I'm actually using just 0.05% retinol, which is not a lot, but my skin's getting a little bit sensitive, so I've stopped using my tretinoic acid, even though that's the best form of vitamin A. So I guess you have to listen to your skin in what, you know, what your skin's doing and how it's behaving when you're putting on products on your skin. And if you find that it's getting irritated, it just might mean that it's not the right form, or you know, you have to fix something else to make sure that you can respond well to the vitamin A. So I agree with that. In terms of vitamin A as well, because we were talking about sunscreen, it's so important for you to wear sunscreen when you're using vitamin A because it makes you more sun sensitive. So I actually take a break probably about 2-3 months in a year from vitamin A. Do you do that?
I don't, and I would say with some of the other formulations, I tend to get more inflammation. But with Dr. Rich's creams, I haven't had that problem. I can keep using them all year round. And this is an interesting thing I was reading recently, Alia, that the fear of increased sun sensitivity with the vitamin A or the retinoic acid is actually sometimes blown out of proportion. So retinoic acid use actually doesn't necessarily put your skin at more risk of sun damage. So that surprised me because I was looking at this study and apparently they didn't see any significantly increased risk. I still think that if we want to scare our patients and tell them to use sunscreen, it's a bad idea. Tell them your vitamin A is making you more prone to sun damage. Please wear sunscreen. Because guess what? When you're wearing vitamin A on your face and you're using sunscreen and reducing your photo damage, your skin overall will benefit so much that, you know, there's absolutely no harm in doing it. And I think there's a question about why do women use collagen. Sorry, this can only a woman would never ask the question. We don't use collagen. All of us have collagen in our faces, in our skin. Your skin is like, it's one of the building blocks of your skin, which is why collagen is extremely important. And as we age, our collagen tends to break down and it doesn't tend to build up as much as it used to. That's why babies look really full and fresh in the face and elderly people look very wrinkled and saggy. It's because they're losing collagen. So that's what collagen is. Why do women use it? Women tend to try and replace what they're losing as they get older. And I think one of the people who joined us has said, can you talk about collagen supplements? So I don't know about different products, but I think there's nothing wrong with collagen supplements. Most of them are actually protein supplements anyway. So if you don't think that your diet is very protein heavy, then go for it. I think there's absolutely no harm. I personally do take collagen supplements in liquid form. So I'll have the shakes and sometimes I'll take the tablets as well. But really, I think it's a little bit of fluff. I just don't want to miss out. I have FOMO. I want to make sure doing everything I possibly can for my skin, but I don't know if it actually makes a difference. So look, there's no harm in collagen supplements. Go for it. I've had a lot of people tell me it really does benefit. So I think there's absolutely no harm. But at the end of the day, the things that make more collagen in your skin are the dermal fillers, because hyaluronic acid actually creates more collagen for you. So that's what we're trying to do with dermal fillers. And a lot of people are so worried about dermal fillers because they think they're going to look really, really unnatural and really fake and weird, but they really don't. If you look at some of our befores and afters for Alia and myself, you'll see that people look quite natural and quite like themselves. You're not trying to make them look different. I think what we're really trying to achieve is make them look like themselves. and slow down the aging process, and in some ways reverse the aging process. So as I said, I think I look better in my 30s than I ever did in my 20s. So I'm very happy. And thank you so much, Molly. Compliment. I think one of my patients actually recently said to me, having cosmetic treatments actually made her feel more empowered. Now, I don't use the word empowered a lot. I don't, because I don't want to be disrespectful to true empowerment. But I think empowerment takes lots of different forms, and just sometimes taking control of how you look and how you feel about yourself can actually make you feel quite empowered. So I think the most important thing about injectables or cosmetic treatments and just looking after yourself is empowering yourself, because as I said in some of my chats before, we are judged by our appearance. Everyone judges you immediately within a second based on your appearance. It's basically how we vet people, how we know someone's a risk and someone's not. So that's quite a natural human reaction. You are completely judged based on your looks by people who don't know you. So looking after your appearance, I think there's absolutely nothing vain or wrong about it. I think it can be quite empowering. So moving on to things like, we'll just very briefly speak about some of the other active ingredients. So as I was saying, I don't think I've had any problems with the retinoic acid I've used that Michael has, or enriched, that we've got formulated. But some people can find that sensitizes them as well. So I think it's all very individual, which products suit you and which don't. And I think you did a really great video the other day, Aliya. If you can talk to us a bit more about that on vitamin C.
Yeah, so I did a really cool video on vitamin C recently on my Instagram. So basically what I did was I used an apple to kind of, and as an analogy for, you know, what our skin is. So I cut 2 slices of apple. I put vitamin C serum on one of the apple slices, and I just left them overnight. And the next morning I woke up, looked at the apple. So this is on video if you guys want to see it. The apple that doesn't have vitamin C was all shriveled, brown and dry. And that happened overnight. And the one with vitamin C looks the same. So it was well preserved. It was very hydrated. There was no brown marks on the apple. So I think that's just goes to show how important antioxidants are for your skin. So antioxidants mean that they're fighting, they're helping your skin fight that free radical damage that's in the environment. So in the environment, there's a lot of free radicals, and it can degrade your skin like the apple. So I think that was a great way to show everybody what free radical damage does and how antioxidant can help preserve your skin if you use it every day. And so vitamin C, I think, is a very important ingredient for a lot of patients who are worried about pigmentation, because it does help with pigmentation. But I think it just creates, you know, like that vibrant, glowing type of skin when you use it long enough. There is a lot of different vitamin C's out there. And I find that, you know, for someone with oily skin, it's quite hard to find the right vitamin C for you. I've used a lot of vitamin C's over the years, and I found that some of them, which are the stronger ones, doesn't agree with my skin. It makes me break out. And then some of them, which are the lower concentration ones, worked better for me. So it's all about finding what's right for your skin again. Same with the vitamin A. And I think that's when people get a little bit confused with what they want to use. Obviously, you know, the easiest thing is for you to come into clinic, for us to have a look at what you're using, what you've used in the past, and what we can recommend for you. So that will be the easiest way for you to sort of, you know, reset your skincare if it's not agreeing with you. Or even if you're finding that you're not getting the best result, it might be little tweaks like increasing your vitamin C content or increasing vitamin A potency and things like that. So there are little things that we can tweak in terms of your skincare in clinic. So I always talk about skincare even though they don't ask about it. So I could talk all day about, you know, skincare and Botox or anti-wrinkle treatments and dermal fillers and things like that. So I think but vitamin C and antioxidants is definitely one of the things that I think is important for you to use. So you'd use vitamin C in the morning and you'd use your vitamin A at night. And I always say vitamin C and vitamin A are like best friends. They actually complement each other and they make each other's actions even bigger, like they boost each other's action, because one is, both of them are photo protective, so they protect you against sun damage, but then at the same time they are also but I don't know, now that you've read this research, they might make you more photosensitive at the same time. Do you find that that's the same with vitamin C, that it can make you photosensitive?
So according to research, vitamin C actually reduces photo damage and it actually protects you in the sun.
Yeah.
But the formulation. So I noticed you were using the SkinCeuticals ferulic acid for your experiment, and I really loved that product actually. And when you actually did that video, I was like, I better go put mine on right now.
It's really daunting to see that, isn't it? I thought it was like, oh my God, I can't believe how, you know, what a little vitamin C can do to preserve your skin. I did use a very, very good vitamin C though, which is the SkinCeuticals CE Ferulic. It's very expensive, but you know, we know why it's expensive, because they've got really good ingredients in there, really good delivery system. Not to say that that's the only one that you can use. You can use any vitamin C on the market. The most important thing is for the formulation of your vitamin C, it has to be stabilized. Vitamin C can degrade very quickly, and it can go off. So you don't want to put something off on your face. So you want to buy something that's stabilized with the right formulation. And the other thing with vitamin C, it will be good for you to have other antioxidant ingredients like the vitamin E or ferulic acid, for example, to help boost each other's action in terms of their antioxidants protection benefits.
And I'm going to disagree a little bit, Aliya, because I tell people if it's cheap for a reason. So there's very few companies, I think, that can make a truly active ingredient without there being a cost attached to it. So there are ones that are definitely on the higher spectrum of spending, and not everyone has to spend that. I would. And the reason being, for me, my face and my skin are definitely worth the investment. I don't care how much money I put in my face. I'd rather wear cheap clothes but have expensive creams on my face. So that's just me. So it's about preference, and it's about, you know, what are your priorities. And I think if your skin is a priority, then it doesn't matter what cost to it is. Secondly, I think that some of the ones that are available over the counter or available and they're quite cheap, sometimes there's a reason for it. So don't go for the cheapest thing because it's cheap. Having said that, some skincare products are actually formulated in a way that they work and they're not too pricey. I think the Ordinary line is quite popular with for that reason. Personally, I'll tell you guys, it didn't work for me. I tried it, every single product I tried from that line. I tried quite a few, used to cause a reaction on my skin. So I have super sensitive skin and it just didn't work for me. So I went back to the SkinCeuticals and I use Dr. Rich's vitamin C. He's got one too. So on days when I'm a little bit oilier, I'll use the SkinCeuticals one because it doesn't make you too oily. But Dr. Rich's one is cream based, so it's a little bit more moisturizing. That's also on a day when I'm dry in winter, I'll use that one. So, and that one's not very expensive either. So you can find ones that are not very expensive. But I think in my experience, the SkinCeutical one lasts you for a long time because you only need 4 or 5 drops of it. The other thing with vitamin C that's very important is, as Aliya said, it has to be stabilized. So the ingredients that it's paired with have to stabilize it. So that's number one. And number two, it has to be in a really dark bottle. And you have to keep it hidden away in a cupboard. And it's the same thing with retinoic acid as well. The active products can degrade very quickly. So you want to leave them in a really dark, cool cupboard. And you never want to take them out until you're using them. So that's just really, so mine are always in my bathroom because it's probably the coolest part of the house. And they're always in a cupboard. So you don't want to leave them out, because you don't want to pay all that money and then your product's not really working for you because it saw sun and it died, which is basically what happens with these things. Now, the other thing I wanted to touch on quickly was chemical peel. So that's the other thing that is just really, I think, low maintenance in the sense that you go every couple of weeks and you have a peel, but it's really, really beneficial for your skin. So the idea behind the chemical peels is that it's going to take off the top layers of your skin, which are dead skin cells, lots of keratin, and all of this is actually stopping your active ingredients from being absorbed into the layers of your skin or your dermis that actually needs it. So a lot of your skincare can actually sit on the surface and not do a lot for you. So you need to make sure that your skin is actually quite porous in some ways to be able to absorb some of those products, and that's where chemical peels or AHAs come in. You can have AHAs in your skincare as well, but sometimes I find I can't use AHAs in skincare. My skin gets too dry, so I
Yeah.
a chemical peel every couple of weeks. And sounds so scary, chemical peel, but can I tell you that most of these chemical peels are actually fruit acid derived, so they come from fruits, so they're actually pretty natural in that way. You can have like an ascorbic acid peel, which is basically vitamin C on your face. So I've tried quite a few of them, and I really love the lactic acid ones because they're good for my dry skin, because I have dry skin and I like to be really dewy. But someone with more oily skin, such as Alia, you said you had oily skin, the glycolics are a little bit better. The other interesting thing I read about chemical peels recently, by the way, is people really worry about their pores. You'd have a lot of patients come in and say, how can
Oh
I,
my God. Yeah.
and it's one of the hardest things to fix. So this is something interesting I read recently, is your pores are basically conical. Okay.
Yes.
Okay, so if you're taking the top layers off your pores with chemical peels, the bottom is more like this. So the pores appear to shrink. So that's something I found was amazing about chemical peels. I'd never realized, because people always say to me, you have no pores. And I said, that must just be my genes. But I think it's actually all the chemical peels I've had. So,
I agree. So the one thing that I need to say about pores is don't use those pore strips. Those pores, you know, those things that they stick on their nose and then they peel off, and they've got like all these little like heads on the pore strip. That is bad. So I used to use that a lot in high school because I didn't know anything, and I used to, because I had a lot of pores. I've got oily skin, so that's really bad for your pores. It actually makes them even more oilier because you're stripping off the oils and you're stripping off everything. So it's actually quite harsh for your skin. So don't use that. I agree. You have to use AHAs or BHAs to help with your pores. And it's a long process. So it's not like you're going to get one peel and suddenly you're going to have amazing skin like Afrah. It takes a lot of work. Skin takes a lot of work. Wouldn't you agree? I think a lot of patients come in and they expect, oh, if I have this one chemical peel, I'm going to be set for life. No, so skin changes every day. We produce dead skin cells every day on our face. Every minute of the day, your skin's just dying. So the chemical peels, and I hate the wet chemical peels as well because it seems so harsh, like it's something so unnatural. But the AHAs, so things like lactic acid, glycolic acid, they're made out of fruits. So they're actually fruit acid peels, which I think is a nicer way to say it. Fruit acid peels actually help rid of that dead. That's exactly what Afra was saying, is that with the pores, because you've got all this dead skin on the top, if you take off those layers of dead skin, then your pores look smaller, but actually it's the same size. And also the other thing with chemical peels and good skincare is you're managing your oil levels. The more dehydrated your skin is, the bigger your pores are gonna appear because they're producing a lot of oil. So that's what pores do, and we need pores because if not, we won't have oils on our face. So we need pores for the oil, and our skin does need oil, but the more dehydrated, the more you're stripping. And I find that that's a very common problem with oilier type of skin and very acneic type of skin, is they strip everything so much because they're like, I'm so oily, and all these pores. But actually, the more you strip, the more you get oil. And because your skin's thinking, oh my God, I don't have oils, I need to have more oil. So they start producing more oil. So it becomes a vicious cycle. So it's very important to recognize all these different factors why your pores look bigger. It's not just, there's no such thing as closing down your pores. I think a lot of people think, oh, how can I get rid of them? You can't get rid of them. You can improve the appearance of your pores by making sure your skin is well balanced in terms of oil and hydration, and making sure that all those dead skin cells are off your face.
And I think you made a good point about people sometimes think they'll have one treatment of something and they'll be set for life. And I say to people, the only way to stop aging and pause that moment is to die. So if you keep, you're going to keep aging. And if you keep aging, you will keep doing those treatments. That means that your skincare, your sun protection, your peels, your lasers, they're lifelong things. It's a commitment you make to your face. And really, who better to make a commitment with than yourself and your own health and your own sanity? Do you know what I mean?
Yeah, it's like fitness. You know, you can exercise, let's say for one day, doesn't mean that you're fit for life. Is the same thing with your skin. So if you want to be fit, you have to work out, you know, 4 or 5 times a week. You have to keep it up. If you want good skin, you have to do things every day, and you have to have those clinic treatments to help support the aging process. And that's a good way to say it. You can't stop aging. You know, the only way to stop aging is obviously if you die. But that's good. It means you're alive and well, and your body's functioning like normal, which is aging is normal. All we do is we're trying to reverse some of those aging that comes naturally, and just trying to support the needs of your skin, or the volume replacement that you need, and those kind of things. But that's a good way of putting it.
Can I tell you, I stole that quote from my, so Dr. Rich says, they say, well, if I've had my skin check, and if I've had the portrait laser, which is an ablative laser, which I might be talking to him a little bit about either tomorrow or next week. So we'll come back and talk about ablative lasers. So ablative lasers are basically things that just strip your skin, right? So I'll have one treatment that will be enough for the rest of my life. That's not true. It'll obviously be enough for the next maybe 5 years. But after that, you are still continuing to age. So you may need another one in 5 years or 10 years. Even a facelift doesn't last you for the rest of your life. So it's very important to remember the commitment to your skin means it's the same as committing to your hair. I can never stop doing things to my hair, right? I mean, I could, but then it probably wouldn't look as polished. So, you always look after your hair. Your skin is the same. It's constantly changing. It's one of your biggest organs. You have to look after it. Now, moving on to very quickly, so we don't run out of time, Aliya.
Yeah.
Our favorite treatments outside of active ingredients and things like that. I just wanted to very briefly say the other things I really, really love. Okay. Look, everyone has their opinion, and they have a right to their opinion. We base our opinions more on research and what we see and what we know from studies based on actual human experience. So, of course, some Europeans can have very dark skin types, just like Aliya and I. So Aliya and I could sit in the sun with a Caucasian person for 10 years, and we would still look younger than them, and they'd look a lot older. So it depends on different skin types as well. And European skin types, like Greek or Italian, can be very similar to Asian skin types in that way. So we're all quite olive. So coming back to the point about lasers, so I'll very briefly speak about some of the laser treatments I love, and then I'll get you to talk about your hair transplants. There's a couple of treatment lasers that I can have at the Enrich Clinic. One of them's a pico laser. So because it's a really rapidly firing laser on low settings, it's actually quite safe for darker skin types. And it can actually tighten skin. It can take away fine lines and wrinkles, treat pigment, and tighten pores. So it's a really good one. So I really love it. When we go back to doing lasers, that's what I do that about once every couple of months. The other one that I like doing is an Irvium laser. Now, Irvium lasers at high settings are ablative lasers, but on low settings can be used for microdermabrasion. But because it's really intense heat, it actually causes a contraction of tissue. So it's actually visible. You see the changes in your skin. It's really beautiful. So those are the treatments I personally love for myself, because I've actually had them without any problems with post-inflammatory hyperpigmentation. So I'll talk a little bit more about lasers with Dr. Rich. I'll get him on one day and we can talk a little bit more about that. But outside of these two lasers, I'm usually quite reluctant to treat myself with anything. I'm sure that there's a few other lasers I can get away with, but I think if it's not broken, don't fix it. My skin's fine. A few preventative treatments are fine. I'm not going to take a risk with things that might cause problems. So moving on to hair transplants, Aliya, can we briefly speak about that? Because you're very passionate about your hair transplants. I've seen some great results. Please tell us a little bit more about that.
So I've been doing hair transplants probably about 5 years now, and it is a very different medicine altogether. It's very different in terms of patient as well that comes through the door. So obviously I see, I would say probably 70% male and 30% female for my hair loss clients or hair loss patients. So hair transplants, so just in a nutshell, people think that hair transplant still looks like plugs from 20 years ago. So plugs are just a collection of hair follicles that they just kind of, you know, transplant into the scalp. Nowadays, the hair transplant, you know, world has evolved so much, and it boggles me that people don't know anything about hair transplant, because at the moment we're transplanting single follicular unit hairs. So we're taking each individual hair and we're literally transplanting them one by one. So for example, if let's say someone's receded on the front section and they want to replace sort of, let's say the front, what we call the frontal area, which is this part, it will take about 1,500 hairs. So we literally transplant 1,500 hairs when we're doing the transplant. So it's quite a big job. It's very specialized, because how you transplant each of those follicles will determine how it's going to grow as well. So there's a lot of intricacies with hair transplants, and I think in Australia there's only a few surgeons that I would recommend for people to go and have their transplants. But hair transplants
Yourself, you'd recommend
yeah.
yourself?
Yeah. But there's you know, as in like in Australia, so in other states as well, so there's not a lot of hair transplant surgeons that do really good, beautiful work. It's actually very difficult surgery. It's microsurgery, so we're wearing you know, those loops all day, and for people who are interested in hair transplants, so that's the only permanent solution to hair loss. However, you need to use medications as well to support or to reduce your future loss, because who knows how many hairs you're going to lose in your entire life. And we only have a certain amount of hairs that we can transplant. So you don't have infinite numbers of hairs to transplant to your face or to your skin. So there's only a finite number. You have to make sure that we're keeping all the hairs that we have with medications and supplements and things like that. But no, I think hair transplants is a very interesting part, and you know, I could talk so much about it, but we actually do not just scalp hair, we also do eyebrows, beards. I've had someone come in for chest hair transplants. It's all very interesting.
Oh, okay. Because I do have patients who've lost hair in their eyebrows, and I see, even I didn't know that you could do hair transplant to eyebrows. So that's really positive to know, because I will send you some patients for that, definitely.
Yeah, so eyebrows are a big thing. Once you overpluck them, they never grow back. The hair follicles are just scarred, basically, if you overpluck your eyebrows, so never do that. But, you know, there was a time in the 90s where everybody was overplucking their eyebrows, so they never grow back. But your eyebrows are beautiful, so you don't have any issues with that.
Came back?
They came back, thank God. But some people, they don't come back. And so with those cases, you know, some people do need their eyebrow transplanted. And we still take, interestingly, we still take hairs from the scalp into the eyebrows.
So does it not then overgrow and get really long?
It does. So for the first few years, you have to trim your eyebrows, because it will...
Right? Because I have too much eyebrow. Like, it's
No. But yeah, for the first few years, before your hair follicles realize now their eyebrows and not scalp hair, they will grow. So you have to trim your eyebrows to make sure that it's, you know, nice and tidy. But then after that, you can do anything to them. You can pluck them, you can, you know, do whatever you want to your eyebrows afterwards. Same with scalp hair. After you've had a hair transplant, you can do whatever you like to your hair. You can bleach them, you can, you know, do anything you want.
Wow, that's incredible. Thank you for telling us about that. Now, I have to ask you, so finasteride and minoxidil are the obviously the medications you use, but what about supplements? Because someone asked about collagen as well for skin. Do you recommend that for hair? And is there any specific supplements you recommend to people? I mean, I know that everyone needs to check their iron levels and their thyroid and everything else and replace whatever's necessary. But is there something specific you'd give someone if all of their levels of everything was fine, something on top of that?
Yeah, so I do recommend Help Hair. So that's a protein supplement. So a lot of the times the supplements that you see over the counter or in the pharmacy, they have a lot of biotin and zinc. So biotin is very good for hair. However, a lot of people don't realize you need protein to help grow your hair. So if you're not eating adequate enough proteins in your diet, or even it's specific forms of proteins that you need for your hair as well. So it's not all proteins. There are specific ingredients that are specific for hairs, and because I don't talk a lot about diet as much as you do probably, but I recommend Help Hair. So Help Hair is a protein, whey protein supplement that helps with hair growth and also muscle strength as well. But it's got all these other ingredients in it that is specifically for hair, and it is in the exact amount that you need. So it's sometimes hard to get all the nutrients that you need just from your diet. So these are the patients that I actually recommend taking Help Hair if they feel like, oh, my hair's not growing fast enough, or my hair's not growing long enough. So these are the patients, or especially before or after transplant, to help nourish their hair to go through that procedure, because a surgery is very, very stressful for your hair follicles. So to avoid them or to help them grow and to boost their growth after transplant, I actually recommend them taking Help Hair as well.
Beautiful. And I think there was a question from one of the people who joined us about, it was just earlier, about eyebrows. Is there any other way to grow them besides a hair transplant? So I think the hair transplant, I would recommend more for patients who've lost, as Aliya said, have scarred their follicles, so the hair follicles just won't grow. But if you've got some hair follicles and then you've got patches in the middle, and if you don't have surgery, the other thing that you can try is Lumigan. So there are drops that you do need a script for them, but and it's quite a commitment because you have to put them on every day, but that can also help thicken hair in the brow. So that's another thing you can try. But like Aliya said, if the follicle's quite scarred and you've got really big patches in your brows, Lumigan won't help. You definitely will need transplant. So that's something to think about. So Aliya, I will take your leave now because I don't want this to run over time and then suddenly and I didn't even get to say goodbye to you.
I know. It went by so quick. It went by so quick.
When you're having
I know.
have more questions, we can always do this again. But I think at today we'll wrap it up and then we'll wait for people to send us more specific questions, and we can maybe do another session in a couple of weeks and talk a little bit more about some of the things we've talked about. And maybe we can expand on the things we kind of rushed through towards the end.
That will be great, Afra. I think we need to have another session because I think we barely got to what I think, what we wanted to talk about today. So let us know, obviously, if you guys have any questions that you want us to answer in the next session, anything about transplants, lasers, let us know. And hopefully we'll include that in our next session. And we'll talk probably more about cosmetic injectables as well in the next session because we didn't get there today.
Thank you, Miley. That's really helpful. And thank you, everyone, for your comments and questions, even the controversial ones. We love it. Please, you can ask us any questions. We're not offended by anything. Like I said, everyone has their own opinions, and we can only give you our opinion based on our experience, the studies and things like that that we've looked at. That's it. Every personal experience is still very different. Aliya, thank you so much for your time. Thank you so much for coming on and answering all my questions. And please, let's do this again very soon.
Yeah, it's lovely to obviously have this live with you. This is our second live together. It's always fun to go live with you. Hopefully we can do another session of this. I would look forward to it.
Absolutely. You have a beautiful day and I'll talk to you soon. Bye-bye.
Thanks, Afra. Bye.